Antihypertensives. Hypertension. So those with a normal blood pressure have a systolic less than 120 and a diastolic less than 80 millimeters of mercury. Prehypertension, a systolic 120 to 139 and or a diastolic 80 to 89. Stage 1, a systolic 140 to 159 millimeters of mercury and or a diastolic 90 to 99 millimeters of mercury. Stage 2 hypertension involves a systolic blood pressure greater than 160 millimeters of mercury and a diastolic blood pressure greater than 100 millimeters of mercury. This is never obtained with one blood pressure. We do different blood pressure checks at different times. One thing that we can do, which is often done initially when there's high blood pressure, is that we can give Lasix and or some other type of diuretic. A diuretic is something that makes you pee. And by peeing, you get rid of some of that intravascular fluid that may be causing a little bit of hypertension. And even if it may not be the cause, we give it, and it may bring that blood pressure down just enough where we just need a little bit of diuresis and we have a better blood pressure. Sometimes we need to use something different. One different thing is the calcium channel blocker. Calcium channel blockers are good in preventing chest pain by opening coronaries to feed the heart. Don't take these with grapefruit juice, as the grapefruit juice allows the med to be absorbed a little bit better and can cause med toxicity. So these calcium channel blockers block some of the calcium from being able to go into these channels on the cell and make the contraction a little bit weaker because of it. So that's how they work. Some common ones are Procardia and nifedipine. When we look at this, we often talk about alpha blockers. Here I'm going to circle over here on the right. Some more sympathetic depressants here. Alpha blocker on the right, that's my cat. I feel like he's kind of the alpha male of the house, so that's why I put that picture there of him. We do look at mini press as a exemplar with this. They have huge vasodilating effects. So when we talked about the vasodilators, we're talking really, I mean, these alpha blockers are the purest of the pure vasodilators. They go in and they just make these vessels huge. Mini press is one of these things, and sometimes you can think of my cat as an alpha male, alpha blocker. Maybe he's mini because he's a cat. I don't know, but mini press is an example of this. And so, again, we talked about this before. They need to rise slowly. Beta blockers. Now, beta blockers, we talked about early on in the discussion when we talked about ANS drugs. So these are sympatholytics, anti-adrenergics, but they're specific to the beta receptors. And many of them can be specific to the beta 1s in the heart, and some of them are not specific, and so they are less specific, and they affect not only the beta 1s but the beta 2s. So you do have some of them that have a risk for asthma effects in people with asthma and COPD. Examples of beta blockers are things that end in OL. So if you see something that ends in OL, it is a beta blocker. So this is the angiotensin renin system, and it's extremely complex, and I don't expect you to remember it. I just expect you to remember some key components, so listen up. There is a direct renin inhibitor. Direct renin inhibitors hit this part of this whole sequela, and they result in lowering blood pressure by inhibiting that renin. An example of this is something called aliskiren or Tecturna. We don't use this very often. The famous one that we use all the time, are the ACE inhibitors. And the ACE inhibitors are the things that end in pril, P-R-I-L. So the ACE inhibitors end in P-R-I-L. So things like lisinopril are ACE inhibitors. They are vasodilators. And when they work on this system, they work on the ACE enzyme here, and they inhibit that in this system. So what you need to know about that is they just inhibit a different part of this pathway of this renin-angiotensin system. You see pril, P-R-I-L, at the end of a word, and you'll know it's very likely an ACE inhibitor. It's a vasodilator, reduces blood pressure, reduces cardiovascular work, and it does have a diuretic effect by decreasing angiotensin II. So it's kind of got an added benefit to that. Sartans are often given to people who can't have ACE inhibitors. So something like candesartan we'll talk about a little bit later here. But these are given to people with problems with ACE inhibitors. Again, the ARBs just affect a different part of the pathway later on in the pathway here. And it's quite all right to not memorize that pathway. In fact, please don't. And then we have the direct-acting vasodilators, and we've talked about these. Please do think of the alpha blockers as very direct-acting vasodilators. Things like mini press. Think of my cat. And because he's a cat, he's mini. But he's an alpha blocker because he is definitely the alpha male. Like I say, with direct-acting arterial vasodilators, you definitely want to make sure that people rise slowly because they have that risk of orthostatic hypotension and of passing out and falling and hitting their head.